Welcome to the Medical Staff Voice Live. I'm Dr. Stanford, Chief Medical Officer at Community Memorial Health System. And I'm joined today by Dr. Katherine Wagner, neurosurgeon. Welcome, Dr. Wagner.
Thank you.
It's good to have you here.
Thanks again.
This is a great opportunity for our medical staff and community to learn more about you and your practice. So we have a few questions that will enlighten us and give us a better understanding and clarity as to what it is about your specialty we should know about.
Sure.
So first thing I'd like to start with is tell me a little bit about yourself. Where are you from? Where did you study and train? And what brought you to Ventura?
Sure. So I'm originally from New Jersey, and I went to college at Wellesley in Massachusetts. And then I did my medical school back in New Jersey, where my family was, and my neurosurgery training in Long Island. And while I was in Long Island, I had several colleagues that came to the West Coast for further training with fellowships. So I decided to do a spine fellowship at Stanford University, which was a really wonderful experience. And when I was at Stanford, I decided that I really enjoyed living in California. So I decided that I would like to stay on the West Coast. And when I saw a job opening here, I was very excited to interview for it.
Well, how fortunate for us that you had this love of California. Excellent, I'm so glad. Well, tell me a little bit about what is your specialty, what is it that you particularly like to do within your specialty, and so forth.
Sure. So my specialty is neurosurgery, and I did additional training in spine surgery. And some of my favorite problems to treat are some of the most common spine problems that we see out in our population. So cervical degenerative disease, lumbar degenerative disease, degenerative disc disease, things like that. An awful lot of people are walking around with these problems, and what I really enjoy about treating it is that I can help people improve their function and their quality of life.
Now, I know for a fact, because I am a referring physician, that the great majority of the spine problems, even the ones that I send to a neurosurgeon for spine surgery, really improve on their own. But it's so valuable to have your insight and guidance for the patient to understand what will probably get better and what will need some surgical intervention.
Oh, absolutely. A lot of patients do well with physical therapy and with interventional procedures like epidural steroid injections and medial branch blocks. Then there's always a few patients who will need surgery, and they may need it shortly after I meet them or eventually in the future. But it's definitely helpful for them to come meet me or other colleagues and then determine if surgery is in the future for them. And if we can manage them with physical therapy and other treatments, we definitely will. But if they have stenosis or other problems that are causing them deficits or weakness or numbness, we may go ahead and consider surgery sooner.
We hear a lot about different kinds of spine surgery. Some people talk about things called microdiscectomies, where they call, little tiny incision, 1-inch incisions. Mm-hmm. Do we do that here?
Oh, absolutely. We do microdiscectomies here.
Excellent.
That's one of my favorite surgeries.
Oh, good. That's what I was wondering. Thank
Yes.
you. And can you give me an idea where your practice is located?
Absolutely. I'm right across the street, 168 North Brent Street, Suite 408.
How convenient. And your practice is you and, I understand, Dr. Westra.
Absolutely. It's me and Dr. David Westra.
Excellent. Yeah, and Dr. Westra has been with us for many, many years and highly respected. So tell me a little bit more about yourself insofar as what is it that you like to do outside of being a surgeon? What do you like to do hobby-wise and activity-wise?
Wonderful. Thanks for that question. Actually, part of the reason I love being in California is because my main hobbies are gardening and hiking. So the best thing about California, I can garden year-round and I can hike year-round.
So are you leaning towards vegetable garden or flower garden?
Vegetable.
Very good. How about any trees?
Not yet, because I'm still renting, but in the future, absolutely.
Good for you. Excellent. Well, the final part of our interview has to do really with stream of consciousness answers that kind of give us some fun in hearing your responses. So we'll start at the top. Early bird or night owl?
Night owl.
French fries or onion rings?
That's a tough one, but I'm going to go with French fries.
Okay. Amusement park or day at the beach?
Since coming to California, my answer is day at the beach. Previously, it may have been amusement park.
Oh, yes, I do remember New Jersey having a few good ones.
Absolutely.
Podcast or reading a book?
Reading a book.
Passenger or driver?
Driver.
Laundry or dirty dishes?
Oh man, that's a tough one. Let's go with laundry.
Okay. Business casual or scrubs, need I ask?
Scrubs. All the way.
If you had a choice between two superpowers, invisibility or flying, which would it be?
Definitely flying so I could avoid California traffic.
Oh, yeah, that would be a real great side of benefit. What is the best advice you would give your high school self with what you know today?
That's a great question. I think I would tell my high school self to stress a little bit less and go with the flow because things will be okay.
Oh, I love that. And that seems to be a real common theme. I love that. That's a great answer. What is the most interesting thing about you that we would not learn from your resume alone?
Oh, that's a good one. You know, when I was in high school, I actually won some public speaking championships. And you might be able to figure that out if you look back, but I tried to get that part off my CV.
Well, I think that's wonderful. Thank you so much.
Of course, thank you.
Thank you for tuning in to learn more about Dr. Wagner. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhshealth.org and be sure to like and subscribe for more from your community health system. Thank you, Dr. Wagner.
Thank you.
You're sure welcome.